At 6, the NHS in crisis. Ambulance response times and A&E waits in England in December are the worst on record. Ambulances took, on average, an hour and a half to reach emergency calls for heart attacks and strokes. The target is 18 minutes. And this is why tonight we have a special report from inside the Royal Bolton Hospital, which is swamped with patients in need of emergency care.
The last 6-12 months have been more challenging than I've ever known in the time I've worked here.
Good evening and welcome to the BBC News at 6. If you called an ambulance in England back in October for someone who was having a heart attack or a stroke, the average waiting time was an hour. The latest figures from NHS England showed just how much that situation has worsened since then. If you made the same call last month, the wait was half an hour longer, a full 92 minutes on average, before an ambulance would get to you. The target is 18 minutes. For weeks, we've been reporting on the unrelenting pressures facing the NHS this winter. Senior doctors have told us the health service is operating on a knife edge. Now, our health editor, Hugh Pym, has been allowed into the Royal Bolton Hospital in Greater Manchester, into A&E, which is at the epicentre of this crisis, to see for himself what patients and staff are experiencing.
We're at 10 on the corridor with no capacity. We're going to come out and assess them in the ambulance, so it'll be one nurse coming out to each patient.
Sue has worked here in A&E for over 30 years.
The last 6-12 months have been more challenging than I've ever known in the time I've worked here.
The department was built to treat 21 patients. Right now there are 60 waiting.
We're running 2 and 3 times above our capacity continually, and often more than that.
Is it sometimes so busy that you can't prevent delays for the ambulance crew?
Yes, it is. Yes, and then that's when we have the big delays and the backlogs, and when we get to that point, we're very often having to go out to the ambulances to see and assess them. We can't even get them in.
And how much has that happened in the last few weeks?
It's happened quite a lot, yes. Yeah.
Away from the noise of A&E is intensive care, the sickest patients, and it's nearly full.
We've got one empty at the minute. So the lady's just gone down to the ward, so just one empty bed. It's manic, to be honest. Obviously there's significant pressure on the NHS, but it's felt busy in as much as it's been really difficult to try and get people home and get discharged from the ward and discharged from here. It's just felt blocked everywhere. It's been really, really difficult.
Back in A&E, the noise of staff and machines is striking.
So as you can see, this is the quad. All the bays are full. We've even had to have some people waiting by the triage area, assessment area.
This is the heart of A&E. Patients tucked into any available space. They've made it off the corridor. Some are waiting to be assessed. Most are waiting for a bed.
Sometimes you can have trolleys in all spaces. So we have had trolleys all around the assessment areas.
Here, there's never a quiet moment with so many patients to care for. A&E is full because Bolton, like other hospitals we've been into, says beds are hard to find. Here, 100 patients are fit to leave but can't because of community care issues. The government's recently given £200 million for extra social care beds in England. How much will it help here?
It may be a little bit too late to deal with the current pressures we're facing, but money is always welcome.
That's yours, I'm afraid.
Royal Bolton is doing all it can to prepare patients for leaving the hospital.
Oh, you're doing marvellous.
We saw how soon after they arrive, staff begin the rehab process.
Perfect.
But flu is adding to the pressure. Diane was so poorly her husband took her to see a GP, who told him to get her to hospital fast rather than waiting for an ambulance.
He were holding me upwards. I couldn't walk straight. And the GP saw me and she got the typed the note out and sent me straight to A&E. So I'd say that GP saved my life.
Staff say flu and COVID pressures mean it's harder than during the worst of the pandemic.
Staff is exhausted. It feels as difficult as it was during COVID, but in fact slightly more difficult because during COVID a lot of services we stopped, but now we're keeping on all the elective services, plus we're managing the pressures at the front end.
The hospital's pointing as many patients as possible who are less seriously ill to other areas of care, but the corridor still looks like this. Despite everything, Susan is philosophical.
The workload's tough. We've had to adapt and change our ways of working, but we're A&E nurses and we take what's put in front of us and we deal with it the best we can.
Hugh Pym, BBC News, Bolton.
Well, as you heard there, one of the big problems at that hospital is the number of patients who are fit to leave but who don't have anywhere to go that has suitable care. Our analysis editor, Ros Atkins, looks at the issues surrounding the crisis in social care. He's here now. Ros.
Sophie, thank you very much indeed. Well, the government has been highlighting one of the problems underlying this winter's NHS crisis.
We've got around 13,000 patients in hospital who are ready to leave hospital. They're medically fit to leave, but are often delayed because of challenges in social care.
And the challenges in social care are acute. They're affected by the capacity in the system, which is struggling with staff shortages. The current staff vacancy rate is over 10%. That's in a workforce of more than 1.5 million. That's the highest since records began. Now, arguably, it's wage levels that are most affecting both recruitment and retention. An average wage for care staff is £9.5. That's the legal minimum wage for most adults.
You can go to a shop assistant, go work in Aldi, and you're on more money than us, with so much less responsibility and stress. And there's not a lot of emotional stress that you take home with you.
And this issue of low pay is connected to funding and to what care providers receive. According to the healthcare charity The King's Fund, social care spending per head has fallen in real terms over the last decade. And that's happening as the adult population increases, therefore putting more pressure on what councils can afford.
This is one of the few vacant rooms we have available at the home at the moment, and it would probably be rented out for something in the region of £1,200 a week. Social services rates would pay a little over half of that.
But it costs the NHS around £1,000 a week more to keep a patient in hospital. And these core challenges for social care are not new, as care providers point out.
There is no political party with clean hands in this. You know, Tony Blair promised us that he was going to reform social care. We are 7 prime ministers down from that. We have all had them telling us they're going to do something. None of them have.
Well, since 2010, there have been 5 Conservative prime ministers. In 2011, a cross-party commission found that social care and its system was not fit for purpose, and it recommended reform. But no reforms came. Then 8 years later, we heard from Boris Johnson.
I am announcing now on the steps of Downing Street that we will fix the crisis in social care once and for all with a clear plan we have prepared.
But the social care crisis is yet to be fixed. And this week, Rishi Sunak's government announced £250 million to buy thousands of beds in care homes and to upgrade hospitals. There's also a promise from the government of reform, including a cap on personal costs. That's been recommended not just to this government, but for over a decade. And the money that's announced this week comes on top of another £500 million that was announced last year. Plus, English councils have been given the opportunity to raise more funds through taxes. Now, last autumn, Sir Andrew Dilnot, the man whose proposals the government says it believes in, had this stark assessment.
We have a system that is creaking, that is falling apart, that is putting enormous pressure on the wonderful people who deliver the care, as well as the individuals who need the care and their families. It's hard to think of a more vulnerable group than people in that position, and our system is something that we should all be ashamed of.
And it's a system the NHS needs to lean on this winter, but social care is struggling to share the load, and patients need 2 systems which can act as one. Back to you, Sophie.
Ross, thank you. Well, joining me now is our health editor, Hugh Pym. Hugh, you've been doing your job for almost a decade. You report on it all the time. What you saw at the Royal Bolton Hospital in Greater Manchester, how surprised were you by conditions that patients and staff are in at the moment?
Well, Sophie, I was very struck by the noise and the stress and the strain, with staff working absolutely flat out to deal with this stream of patients in buildings really designed 10 years ago or more than that to cope with a far lower number of patients then. And it's similar for many other hospitals, these very cramped conditions. But at Bolton, they're doing all they possibly can under the standard A&E playbook. You stream patients, you move the less seriously ill away from the front door, away from the main bit of A&E to a minor injuries unit or an urgent care centre with a GP. They feel they're doing all that, but still they end up with the sort of scenes that you've seen there. And many, many other hospitals are seeing something similar. Now, NHS England said there was a record number of people in England going into A&E in December, 2.3 million, a record number of 999 calls. And I think all this underlines the need for an urgent debate about the future of emergency care and how it can be improved next winter.
Hugh Pym, thank you. And you can check out the situation with waiting times at your local hospital service by using the BBC's NHS Winter Trackers on our website. Wherever you are in the UK, just put in your postcode to see the latest published information, waits on A&E, routine operations and ambulance. That's bbc.co.uk/NHS Tracker.